Gentlemen, let me ask you something, and I want you to be honest with yourself, okay? You go to the gym, you do your morning walks at East Coast Park or Bedok Reservoir, you maybe even join those Tai Chi sessions at the Void Deck, you take care of your arms, your legs, your heart, but have you ever thought about training your penis? I know you hear this and you think, wow, this doctor talk what kind of thing, but stay with me lah, because what I'm going to share with you today, it can change your life. After more than 30 years as a urologist here in Singapore, I've seen thousands of men walk into my clinic at Mount Elizabeth, men from Jurong to Tampines, from Woodlands to Pasir Ris, all with the same worry on their face. They sit down, they cannot look me in the eye, and then slowly they tell me, Doc, I got problem downstairs, cannot perform already. You see, just like your biceps need exercise to stay strong, just like your heart needs cardio to keep pumping, the tissues inside your penis also need conditioning to stay healthy, elastic, and capable of producing reliable erections. This is not some new age nonsense or internet gimmick. This is medical science, and I've seen it work for my patients time and time again. So if you're a man in your 50s, 60s, 70s, or even 80s and you thought your best days are behind you, I'm here to tell you that's not true at all. Stick with me, because by the end of this video, you'll understand exactly why this approach works and how to safely take your penis to the gym with simple, science-backed exercises that can help protect you from erectile dysfunction as you age. Before we go further, do me a favor, Ken. Hit the like button so more men can discover this information. I know we Singaporean men, we're shy to talk about these things. We rather suffer in silence than admit God problem, but sharing this video, you might help your kakis, your golf buddies, your friends from NS days who are also struggling, but too paiseh to ask. Drop a comment below and tell me where you're watching from. I love seeing our community of men from all over, not just Singapore, but Malaysia, Indonesia, Hong Kong, Australia, everywhere, got Singaporean diaspora. And of course, you can subscribe if you want more practical health advice that keeps you strong and confident at every stage of life. Let me share with you something that happened just last month. Uncle Tan, 72 years old, retired civil servant, came to see me at my clinic. He told me, Dr. Teo, I thought this part of my life was finished already. My wife and I, we haven't been intimate for 5 years. I thought it's normal getting old, ma. But you know what? After following the protocol I'm going to teach you today, combined with some lifestyle changes, he came back 3 months later with a smile on his face. He said, Doc, my wife asking me what happened, why suddenly so energetic. That kind of transformation, let me tell you, it never gets old for me even after 30 years. Seeing a man get his confidence back, seeing couples reconnect, that's why I do this job. Now, there's a myth floating around that I need to address first. Many people think erections are just about desire lah, about whether you find your partner attractive or not, about performance in the bedroom. But here's the truth that many men don't know. Erections are fundamentally about vascular health and muscle health. Inside your penis are two spongy chambers called the corpora cavernosa. These aren't just empty spaces waiting to be filled, okay? They're made up of specialized smooth muscle fibers and blood vessels. When you're aroused, your brain signals nitric oxide to relax those muscles. Blood rushes in, the veins at the base get compressed, trapping the blood so the erection stays firm. It's like a hydraulic system, very sophisticated engineering by nature. Now here's the catch, and this is the part that most men don't understand. Just like any other muscle in your body, if these erectile tissues aren't used and oxygenated regularly, they can stiffen, lose elasticity, and develop scar-like tissue called fibrosis. You know, when you don't exercise for a long time, your muscles become weak and stiff. Same thing happens down there that makes erections weaker and less reliable over time. So the real truth is this: erections aren't only about testosterone or attraction or how much you love your wife. They're also about keeping the erectile tissue itself conditioned and healthy. And that's where what I call the penis gym comes in. For those of you new to my channel, I'm Dr. Natalie Teo. I've been practicing urology for more than 30 years, starting my career at SGH before moving to private practice. I've helped men from all walks of life, from taxi drivers to CEOs, from hawker store owners to senior civil servants. I've worked with men in their 20s who got performance anxiety, men in their 80s who refused to give up on intimacy, and everything in between. And I can tell you something very clearly: erectile dysfunction is not just about aging, it's about circulation, hormones, and yes, tissue fitness. Let me give you an analogy that my patients always find helpful. example, if you put your arm in a cast for 6 weeks because you broke your wrist, what happens? The muscles shrink, right? They become weak. When the cast comes off, you need physiotherapy to rebuild strength. Same principle applies here. If you stop moving your penis, whether because of stress from work, illness, medication side effects, or just reduced sexual activity because your wife also tired or got health issues, the tissues inside can also decondition. They become weak, less elastic, less responsive. That's why men who stay sexually active or who deliberately exercise their erections often maintain better function into later life. I see this pattern again and again in my practice. The men who stay active, they do better. It's that simple. I remember one patient, Mr. Lim, 68 years old, came to me very depressed. His wife had passed away 2 years before, and he thought that chapter of his life was closed forever. Then he met someone new at his church community group, a lovely widow, and suddenly he wanted to be intimate again, but his body wasn't cooperating. He was so embarrassed. He told me, Dr. Teo, it's been so long, everything down there, like already retired. But we worked on it together using the methods I'm going to share with you, and 6 months later, he was so happy. He even sent me a card when he got remarried. That's the kind of story that keeps me going. Now, you're probably wondering, okay, doc, what's the actual workout? How do I exercise my penis safely? Don't worry, I'm getting there. But first, I want to share with you the 4 most common mistakes I see men make when it comes to their erectile health. These are mistakes I've observed over 30 years, and avoiding them can make all the difference. Mistake number 1, relying only on spontaneous erections. Most men think that if they're still getting morning wood, they're in the clear. Especially you older gentlemen, you think, wow, I still wake up with erections sometimes. Means everything okay, what? But here's the problem. Nocturnal erections, what we call morning wood, can decline with age, stress, poor sleep, or health issues like diabetes, high blood pressure, or heart disease. And in Singapore, let me tell you, these conditions are very common. We love our char kway teow, our nasi lemak, our roti prata with sugar. Our diet is not exactly heart-friendly, you know what I mean? Biologically, those nighttime erections are your body's way of aerating the erectile tissue, bringing in oxygen-rich blood, and keeping the muscle fibers pliable. It's like your body's automatic maintenance system. Without them, fibrosis creeps in, the tissue becomes stiff and scarred, and suddenly you notice your erections aren't as firm as before. Here's the practical fix. You cannot just rely on nature to do the job for you anymore, especially once you pass 50. That's where the vacuum erection device comes in, sometimes called a penis pump. Now, I know some of you hear penis pump and you think of those dodgy advertisements or those jokes in movies, but used properly under medical guidance is actually a legitimate therapeutic device. We prescribe these at hospitals and clinics. It draws fresh, oxygenated blood into the penis, giving those tissues the workout they need. And think of it like physiotherapy for your penis. One of my patients, retired teacher, 75 years old, he was very skeptical at first. He said, Dr. Teo, this thing looks like some kind of contraption I paise to use, but I explained the science to him, showed him the research studies, and he agreed to try. Now he uses it religiously 3 times a week, and his erectile function has improved significantly. He told me it's become part of his routine, just like his morning exercises at the park. Mistake number 2, thinking more pressure means better results. This is where a lot of men go wrong, especially those who are impatient or who have the kiasu mentality. You know, more is better ma. They think pumping harder or longer will make their penis bigger or stronger. That's not how this works at all, and it can actually cause damage. Biologically, the goal isn't to stretch your penis like a balloon until it's about to pop. The goal is to gently engorge the tissue, oxygenate it, and train the veins and muscles to hold blood efficiently. Too much pressure damages blood vessels, leading to bruising, pain, and even scar tissue formation. I've seen men come to my clinic with injuries because they were too aggressive. One poor fellow, he pumped so hard he got blood spots all over his penis, scared himself half to death thinking something terrible happened. Here's the practical fix, and please remember this: slow, gentle intervals. Think of it like doing reps at the gym. You don't go and lift the heaviest weight on your first day, right? Same principle. Pump slowly to a full, comfortable erection. Not painful, not stretched to the maximum, just comfortably full. Hold for about 30 to 60 seconds, then release and let the blood flow out naturally. Repeat this for about 10 to 15 minutes total. That's your set. Nothing extreme, nothing painful, just consistent training. Quality over quantity, always. The research supports this approach. A study published in the Journal of Sexual Medicine found that men who use vacuum devices regularly showed improved erectile function scores after just 3 months. Another study from Singapore General Hospital, our very own local research, showed that consistent use combined with lifestyle modifications produce the best outcomes. This isn't bro science or internet rumor. This is evidence-based medicine. Mistake number 3, ignoring the lifestyle piece. Let me be very direct with you here, and I say this with love. You cannot outpump a bad lifestyle if you're smoking 1 pack a day, drinking beer every night at the kopitiam, eating fried food for every meal, not sleeping properly because you stay up watching football matches and you haven't exercised since your NS days. No amount of penis exercises will fully compensate for that. Smoking, heavy drinking, untreated sleep apnea, belly fat, high blood pressure, high cholesterol, all these things choke off blood flow and lower testosterone. And here's something I always tell my patients: your penis is like the canary in the coal mine. If blood isn't flowing well there, it's a warning sign for your heart and brain too. Why? Because the penile arteries are only about 1 to 2 millimeters in diameter, far smaller than your coronary arteries. If there's plaque buildup affecting blood flow, you'll notice it in your erections first, sometimes years before you have a heart attack. I cannot tell you how many times I've had a patient come in complaining about erectile dysfunction, and when we do a full workup, we discover he has blocked coronary arteries or dangerously high blood pressure. Just last year, one man came in thinking his problem was just bedroom performance, and we ended up finding out he needed a triple bypass surgery. His erectile dysfunction literally saved his life because it made him come see a doctor. Here's the practical fix for lifestyle. Walk 30 minutes most days. In Singapore, we're so lucky. We have so many parks, park connectors, shopping malls with aircon if you don't like the heat. No excuse not to walk. Do strength training twice a week. You don't need fancy gym membership. Use the fitness corners at HDB Void Decks. Do bodyweight exercises at home. Join those free exercise sessions at community centers. Cut back on alcohol. I'm not saying don't drink at all, but moderation is key. Quit smoking. I know it's hard, but there's so much support available now through polyclinics and smoking cessation programs. Sleep like it matters, because it really does. 7 to 8 hours, consistent timing. Your testosterone production happens mainly during deep sleep. Your penis gym only works if your whole body gym is in order. You cannot separate the two. Everything is connected. Mistake number 4, thinking is just about size. This one is emotional, and I understand where it comes from. Many men pick up a pump thinking it's a shortcut to adding inches. They watch some advertisement or read some exaggerated claims online, and they expect to become some kind of adult film star. When that doesn't happen, when they realize their penis isn't magically growing bigger permanently, they give up and think the whole thing doesn't work. Here's the truth, and I need you to really hear this. The durable, lasting benefit of these exercises isn't permanent size increase, it's function. It's about having firmer, more reliable erections. It's about confidence in intimacy, being able to perform when the moment comes without fear or anxiety. It's about dignity and freedom. The freedom to be intimate with your partner without worrying whether your body will cooperate. I had a patient once, a very successful businessman, owned several properties, drove a Mercedes, but he was miserable because he couldn't perform in the bedroom. His marriage was suffering. He told me, Dr. Teo, I would trade all my money just to have reliable erections again. That's when I realized it's not about size at all. It's about function, connection, intimacy. Those are the things that really matter. Practical fix, shift your mindset. This isn't about building a bigger penis to impress anyone. This is about building a healthier penis that stays strong and functional for decades. That's the real goal. Size is just ego. Function is quality of life. Now, let me give you the simple weekly routine that I recommend to many of my patients. This is based on 30 years of clinical experience and the latest research evidence. 3 to 5 days per week, do a 10 to 15 minute vacuum device interval session, pump gently to a comfortable full erection, hold for 30 to 60 seconds, release completely. Repeat this cycle throughout the session. Don't rush, don't force. Consistency is more important than intensity. During your rest periods between cycles, practice pelvic floor exercises. These are sometimes called Kegel exercises. Yes, the same ones women do after childbirth. Men benefit from them too. Contract the muscles you would use to stop urine midstream. Hold for 3 seconds, then relax for 3 seconds. Do 5 to 10 repetitions. These exercises strengthen the base muscles that support erections and help you maintain firmness. Daily movement is essential. If you have a desk job or you sit a lot watching TV, make sure to get up and move around every hour. Walk to the hawker center for lunch instead of ordering delivery. Take the stairs instead of the lift for a few floors. Blood flow matters tremendously for erectile health. Strength training twice a week, push, pull, squat, hinge. These compound movements build muscle and help protect your testosterone levels. You don't need to become a bodybuilder, just maintain a functional strength. Sleep 7 to 8 hours every night. That's when your natural testosterone production peaks and when your body does natural erectile maintenance through nocturnal erections. Poor sleep is one of the biggest hidden causes of erectile dysfunction I see in my practice. Optional and only if your doctor approves based on your health conditions, you can pair your exercise sessions with a natural nitric oxide boosters. L-citrulline, which is found naturally in watermelon, or L-arginine, can help improve blood flow and make the exercises more effective. But please talk to your doctor first, especially if you're on medication for blood pressure or heart conditions, because these supplements can interact with certain drugs. Let me also address something that I know many of you are thinking about: medication. Yes, drugs like Viagra, Cialis, Levitra, they work. I prescribe them regularly. But here's what I want you to understand. Medication treats the symptom, not the underlying cause. If you rely only on pills without addressing the tissue health, lifestyle factors, and overall fitness, you may find that over time you need higher and higher doses, or the medication becomes less effective. The approach I'm teaching you today, the penis gym concept, it works alongside medication if you need it, and it can actually make medication work better because you're improving the underlying tissue health. Some of my patients have been able to reduce their medication dosage after consistently following this protocol. Of course, never change your medication without consulting your doctor. Now, I want to pause here because if you're a man watching this and thinking, "Dog, I feel like my best days are behind me. I'm too old for this already." I want you to hear me clearly, and I speak from 30 years of seeing patients. That is simply not true. Erectile function is not just about youth, it's about habits. I've seen men in their 70s and 80s who still enjoy satisfying, confident intimacy with their partners. Why? Because they kept their circulation healthy through regular exercise. They kept their hormones balanced through proper sleep and stress management. They maintained their weight at reasonable levels. And yes, they exercised their erections, either through regular sexual activity or through the methods I've described today. This isn't about being some kind of super performer or having unrealistic expectations. It's about being the best version of yourself at whatever age you are. It's about feeling comfortable in your body, confident with your partner, and free from the anxiety that comes with unreliable performance. That anxiety, let me tell you, it can destroy relationships and self-esteem. I've seen strong, successful men become depressed and withdrawn because of erectile problems they thought they couldn't fix. One more story I want to share. Mr. Goh, 81 years old widower, met a lovely lady at his senior activity center. They developed feelings for each other, but he was terrified of physical intimacy because he hadn't had an erection in years. He thought his equipment was completely retired. His children encouraged him to see me. Very progressive family. I was impressed. We worked together on a comprehensive plan, including the vacuum device protocol, lifestyle modifications, some medication support, and pelvic floor exercises. 9 months later, he called me to share that he and his lady friend had been intimate for the first time. He was crying on the phone, happy tears. He said, "Dr. Teo, I thought this part of life was over for me. Thank you for giving me back my dignity. That call, I will remember it forever." So here's your takeaway from today. Use it or lose it. This is not just a saying, it's a biological principle. Treat your penis like the valuable organ it is. Train it gently, consistently, and smartly. Combine that with lifestyle habits that support blood flow, hormone balance, and overall cardiovascular health. Address any underlying medical conditions like diabetes, hypertension, or high cholesterol. Get enough sleep. Manage your stress. Stay physically active. And remember, it's never too late to start. Whether you're 55 or 85, your body can still respond to proper conditioning. I've seen it happen countless times in my career. The human body has remarkable capacity for recovery and adaptation, even at advanced ages. You just need to give it the right stimulus and support. If this video helped you, I'm going to ask you to do two things for me. First, hit the like button so more men can find this information. I know we don't like to talk about these things openly in our Asian culture, but by helping this video reach more people, you might help a friend, a brother, an uncle, or a colleague who is suffering in silence and too embarrassed to seek help. Second, drop a comment below of telling me what's one healthy habit you're committing to this week. Maybe it's starting to walk every day. Maybe it's finally cutting down on smoking. Maybe it's trying the vacuum device protocol. Whatever it is, write it down as a commitment to yourself. And I'll try my best to reply to comments when I can, though sometimes my clinic schedule makes it challenging. If you haven't already subscribed to my channel and hit the notification bell, I share evidence-based men's health advice regularly, covering topics from prostate health to testosterone optimization to bladder issues to sexual wellness. No shame, no judgment, just practical information you can use based on real clinical experience. Before I go, let me address one more thing. Some of you might be wondering whether you should see a doctor about your erectile issues or just try these methods on your own first. My advice is this: if you're experiencing persistent erectile dysfunction, please do see a doctor for a proper evaluation first. Not because these methods don't work, but because ED can sometimes be a sign of underlying health problems that need attention, like heart disease, diabetes, hormonal imbalances, or even depression. A proper checkup can identify these issues early when they're easier to treat, or once you've been evaluated and any underlying conditions are being managed, then these exercises and lifestyle modifications can be powerful additions to your treatment plan. In Singapore, you can start with your GP or go to a polyclinic for a referral to a urologist if needed. Many restructured hospitals have excellent men's health clinics. Don't let embarrassment stop you from getting help. We doctors, we've heard everything. Nothing surprises us anymore. Our job is to help you, not to judge you. Gentlemen, aging is not the end of vitality. Getting older doesn't mean giving up on intimacy, pleasure, or connection with your partner. With small intentional steps, with consistency and patience, you can protect your erections, your confidence, and your freedom for years to come. You deserve that. Your partner deserves that. Your quality of life in your golden years deserves that. I'm Dr. Natalie Teo, reminding you to take care of your health because you are absolutely worth it. See you in the next video. Stay healthy, stay strong, and stay confident.